We are getting a slightly late start. It is 3:32 p.m. Going to go ahead and call the October meeting of the McLean County Board Health Committee to order. We have members Byrne, members Hanson, member Tompkins, and member Farley present. We are missing members O'Neill and member Bangert. Sorry, pulling up my list here. We have a quorum present. Member Beverly Bell has requested to attend remotely pursuant to County Board rules. Member Bell will be allowed to attend remotely if there is a motion and a second, and the motion is approved by those in attendance. Can I have a motion? Motion by member Farley, second by member Hanson. Those in favor?
Aye.
Aye. Those opposed? Please let the record show that member Bell is present for the meeting. Bev, how you doing? Can you hear us okay?
Yes.
All right, we can hear you as well. Moving on. Pull my agenda up. There you go. Next, we have the consent agenda, approval of the minutes from the September 2nd meeting, and recommendations of approval of bills and transfers, if any, to the county board. Those bills total $628,510.82. Can I have a motion? Motion by member Tompkins, second by member Hanson. Those in favor?
Aye.
Motion
Aye.
passed. Those opposed? Thank you, Bev. Motion passes. Moving on to item number 4. Item number 4A, Jason Tabb, Juvenile Detention Superintendent. Item to be presented for action. 4A1A, a request approval of a resolution amending the funded full-time equivalent position resolution for fiscal year 25 for Fund 0135 for a reclassification of the registered nursing position at the JDC. Can I have a motion? Motion by member Tompkins, second by member Farley. Superintendent Tabb, anything to add?
Nothing to add. We're just trying to be comparable to other RNs in the area because it is a specific RN requirement for this position.
Excellent. Okay, we're happy to pay folks what they earn. So those in favor?
Aye.
Aye. Those opposed? Motion passes. Thank you very much. Mr. Tabb, anything else aside from your general report?
Nothing other than the report if you have any questions.
All right. Any questions for Mr. Tabb? Thank you, Mr. Tabb. Moving on to 4B, Jessica McKnight, Health Department Administrator. We have no items for action. Director McKnight, anything to add?
You do have my monthly report, which does highlight our community health services and maternal child health division. And did also want to just reiterate that despite the federal government shutdown, our WIC clinic is still business as usual. So individuals can still come in and get their WIC benefits and cash their WIC benefits. So I just wanted to make sure that the public is aware of that.
Actually, excellent. Thank you very much. It is very good to know that we are being so proactive about preserving things that are in place and keeping things moving business as usual. Thank you, Director McKnight. Moving on to 4C, Mr. Wiley, Nursing Home Administrator. We have one item for action. 4C1A, request approval of a Veterans Care Agreement with the U.S. Department of Veterans Affairs. And can I have a motion? Motion by Member Hopkins, second by Member Hanson. Mr. Wiley, anything to add?
Hello. This is just a renewal of an existing agreement.
Excellent. Any questions? Those in favor?
Aye.
Those opposed? Motion passes. Thank you very much. Moving on to 4D1A, Diane Hughes, Jail Superintendent. I see no items for action today. Ms. Hughes, anything to add?
No, the report's submitted. Ms. Strum unfortunately couldn't be here. She's working the floor.
Okay, thank you very much. Any questions for jail staff? Excellent. Thank you very much. Moving on to item 4E1A. 4E1A, Cassie Taylor, County Administrator. What do you have for us?
I have a few items to present this evening related to the budget. So the first item that I'd like to present is our request approval of Tort Judgment Fund 0135, Department 0077, fiscal year 2026 recommended budget for both the Juvenile Detention Medical Program 0022 and the Jail Medical Program 0073.
Excellent. Thank you.
And I will have a presentation, PowerPoint presentation after it's on the floor.
Understand. So we have a action item today, 4E1A, request approval of tort judgment fund 0135, Department 0077, fiscal year 26, recommended budget for juvenile detention medical program 0022 and jail medical. Can I have a motion? Motion by member Hanson, second by member Farley. Those opposed, or those in favor? Aye. Aye. Those opposed? Motion passes. Thank you very much. Item 4E1B, request approval of Health Department Budget 0061, fiscal year 26, recommended budget, including, do I need to read all of that?
Yes.
All
and so
right, here we
what-
go. Oh, I'm
Before
sorry.
you read it all, if you would like to take that as one item for the health department, that is the different levies for the health department budget. So if you'd like to take those as one item, you could read them all, B1 through B8. But that is a hefty,
That sounds like a
lift.
plan. Let's take this all as one item. So we have 4E1B1, Dental Sealant Grant Fund 0102, Personal Health Service Program 0062, and 4B2, WIC Grant Fund 0103, Personal Health Services Program 0062, and 4B3, Preventative Health Program Grant Fund 0105, Health Promotions Program 0067, and 4B4, Family Case Management Grant Fund 0106, Personal Health Service Program 0062, and 4B5, AIDS Communicable Disease Control Grant Fund 0107, Environmental Health Program 0061, and Personal Health Services Program 0062, and 4B6, Federal Financial Participant Program Grant Fund 0109, Personal Health Services Program 0062, and 4B7, Persons with Developmental Disabilities Grant Fund 0110, Mental Health Program 0060, and 4B8, Health Department Fund 0012, with all the subheadings. And we will take this as one item. Can I get a motion? Motion by member Farley, second by member Hanson. Those in favor?
hang on,
Oh,
I'd like
sorry.
to do my presentation,
Oh,
please.
And do we have a chance to ask any questions?
Yes. Sorry about that. Trying to move quickly.
Yeah.
Administrator Scheller, please continue.
Yes, so Dan, if you could jump ahead to slide 7, please. There we go. This action item will include all of the health department funds. That includes levied funds as well as grant funds. And just a reminder for those who might be listening, the purpose of the McLean County Health Department is to fulfill the public interest in assuring conditions conducive to good health and providing leadership in promoting and protecting the health of county residents. Moving on to breakdown of their tax levy. As you read off all of those different programs, you can see them also listed here. This breakdown of the tax rate indicates how all of those funds are being allocated across programs. Overall, the aggregate tax levy rate for the 110 and 112 funds decreased slightly from last year. The health department is utilizing fund balance where appropriate in those separate funds. For revenues for 2026, the total budget for the health department is $10,348,662. The rate is listed there, and you also have a breakdown of the revenues by the different sources. We have general property tax at 54%, intergovernmental agreements at 31%. Those include grants. License permits and fees are 5%, charges and transfers and fund balance are all less than 10%. Moving on to the next slide. Health Department expenses. This pie chart shows the total expenses for the department that, as you might expect, also equals 10.3 million. 55% of these expenses support the salaries for employees and 42% fund different services offered by the department. If we look only at the special funds that are grant supported, this pie chart shows those funds, and they account for $225,195, about 3.2 million of the overall budget for the health department. This includes programming for the dental clinic, the WIC program, preventative health, family case management, and the communicable disease program. Some of these programs also have charges for service or fees that help supplement those revenues. But that's the breakdown of expenses for special funds. Then the next slide, these are the expenses that rely primarily on tax dollars. And so these programs primarily levy for their support, and they include persons with developmental disabilities, the mental health funds, the environmental health funds, personal health services, administrative support, immunizations, health promotion, and TB care and treatment. The total for these programs is $7,123,467. And those are my overall slides for this fund. If you have specific questions for line items, now is the chance to discuss that.
Questions for Administrator Taylor? Member Hanson?
Hi there. Thank you so much for all of your hard work on this. I noticed with family case management in our health packets, that is on page 53, when we're looking at revenues, we have 3 federal grants that we're looking at. And for at least All Our Kids and Better Birth Outcomes, we have not, it appears to me that we have not received that federal funding. Am I correct in that interpretation?
I would turn this over to Jessica McKnight to answer that question.
Well, and we have since fiscal year 25, the current fiscal year that we're in, and 26, seen a change in the grants. So if you give me a minute here, I can check to see, because you're looking at the 2025 actual amount. So
Yes.
see, okay, because it may be that they are in a different line.
Okay.
So Better Birth Outcomes, federal portion, that will be the only place in 2026 that you see that grant, versus there's a family case management and other things in 2025. So it looks like we have received some of our family case management revenue for 2025. And so again, the Better
Okay.
Birth Outcomes, family case management in this current fiscal year, and the high-risk infant, they're all combined. So there's 3 different lines or 4 different lines in 2025, whereas in 2026, they're in different lines for next year's budget.
I think that makes sense.
It's a little complicated next year. It looks like we have received revenues for at least family case management and Better Birth Outcomes, the state portion. So that also could be that it's state versus federal in this year.
Okay. I guess the reason why I brought it up in the first place is I just wanted to make sure that we weren't preparing to receive funding that we ultimately would not get from the federal government.
Yeah, and we do invoice. We're always a little bit behind because you're invoicing for the previous month's work or even the previous quarter's work. So we've been keeping an eye quarterly on our revenues that we were receiving, and not a concern at this time.
Okay. Then that answers my question with that. Thank you very much.
Not a concern at this time. Okay, thank you very much for that. Member Tompkins, do you have a question?
Yes, I did. Concerning item E1, B1, the dental sealant grant fund. I just wanted to ask generally, there have been some concerns about the effectiveness, the actual effectiveness of the sealants, and that the vast majority of the sealants available are a resin-based product that contains BPAs. Do you know if we are using the newer, more expensive sealants? And my second point to that is the application itself of the sealant is of critical importance, because if improperly applied, can actually accelerate tooth decay. And I just wanted to bring that up because I saw it on the line there.
So I do not know what type of sealant that we do use. The title of the fund is the dental sealant grant, but this actually is all of our children's dental services. So we no longer have a dental sealant grant necessarily, but do potentially offer the service of dental sealants. So it would also be, caries and performing other, cleanings, the prophies. So I can check on what type of sealants that we provide, but get more information for you.
Good point. Thank you, Member Tompkins. Be curious to know about that myself. Any other questions related to this particular item? Good to take a vote? All right. Voting on this item, this will be 4E1B and all of its subcomponents there. Those in favor? Aye. Those opposed? Motion passes. Moving on to 4E1C, request approval of Nursing Home Fund 0401, Nursing Home Department 0090, fiscal year 2026 recommended budget, including C1, Nursing Services Program 0080, and C2, Social Service Program 0081, C3, Activities Program 0082, C4, Dietary Program 0083, C6, Domestic Services Program 0085, and C7, Plant Operations Maintenance Program 0086, and C8, General Administration Program 0087. Administrator Taylor.
Do we want to get a motion on the floor
Oh,
first?
sure, let's get a motion. Can I have a motion by Member Tompkins, second by Member Hanson? Thank you.
Thank you so much. So I do have some slides for this as well, just a very few. But before we begin that, I'd like to remind everyone of the mission of our McLean County Nursing Home. The nursing home provides quality care in an atmosphere that allows both residents and their families to feel comfortable and welcomed during the residents' stay. McLean County Nursing Home recently celebrated 50 years with a solid reputation in the community for providing consistent, quality care. We uphold that reputation by continuing to maintain and improve our standards of excellence for the next 50. Go ahead.
So sorry to interrupt, just to call attention to that. How many counties in Illinois have a county-run nursing home? We're single digits, isn't it, Mr. Wiley?
It's 17 now.
17 now, okay, out of 102 counties. So we're pretty unique in that regard and run a pretty good ship there. So anyway, thank you. Just wanted to call that out.
Thank you.
Please continue.
Yes, thank you for that added commentary. As we look at the revenues for 2026, the total budget for the nursing home is $12,445,576. The revenues by source show intergovernmental funds of 27%, charges for service at 64%, and transfers at 9%. Charges for service, which are the largest source, include private pay services and Medicaid. Intergovernmental revenues include Medicare, VA revenue, State of Illinois revenue, and any reimbursements from the Juvenile Detention Center for laundry or food. And transfers are from the tort budget. When we look at expenses, they also, we present a balanced budget, so they also total 12.4 million. Balance with revenues, you can see there in the pie chart that 71% of costs are for salaries and employee fringe benefits, as you would expect from the high quality of care necessary from a nursing home. And this budget is predicated on an average census of 93 per month. And I'm happy to answer any questions. And we have Tim Wiley here as well for the details.
Mr. Wiley, I have a quick question. I know that our census is slightly down because of the renovations. Rough guess, where would you say the average census has been since the renovations have begun? I know for a while we were averaging about 100, and I know it's down. What would you say it is about now?
We are around 80
Around 80?
at this time, yes.
Okay.
Yes, for the budget revenue, I took 180 days at the construction census and 185 days at the census that we hope to be at in a full, when the facility's fully opened. That's how we arrived at the 93. Just to give you a little perspective, if the facility were fully open the entire year, we would have been able to base the budget on around 98 residents per day.
Okay, thank you. Any other questions for Mr. Wiley? Member Hanson?
This is more so just clarification because I'm excited to see a decrease in budget when possible, but and I'm looking on page 94 for those that want to follow along. In the services under temporary employment services, it looks like you've been able to bring that number down quite drastically. Is the temporary services, is that related to renovations or how, yeah, I'm curious. Tell me more.
So the reduction in agency staffing is 66% over last year, 66% reduction in the utilization of agency staff. And it's been a combination of our hiring practices. We're seeing improved retention. And thirdly, we've been evaluating our staffing model and have found some areas to improve the efficiency of it.
Thank you. We've talked about this in meetings before, but it is really important to this body and clearly you that when we invest in people, we are far more successful. And I just want to applaud you for being such an example of that. Thank you.
I appreciate you bringing that up because my emphasis is our product is our people. I've been in this industry a long time in private sector most of my career, and there tends to be confusion that the product are the amenities or the product is the facility, but the product in our minds is our people, and rather than labor costs being a necessary evil, we view that rather as our investment in our product, and so we just try to stay away from waste, but we view that as having a strong ROI in the end.
Any other questions? Member Tompkins?
Yes, sir, Mr. Wiley. I agree with Member Hanson about the people, and my question is, we've a couple of times during the past year had to come back and increase some salary levels because we just weren't competitive. Do you feel that the salaries in this budget for this budget cycle are going to be anticipatory enough ahead so we won't have to do that again?
Specifically, where we found ourselves a little out of step with the rest of the industry was with one particular position, with a licensed practical nurse. We have not changed the wage scale for that position. I think there is some evaluation, some wage study in process that can help with that. For right now, it's working for us just to bring those individual cases to the Health Committee and to the board for that one particular position. The rest of our positions that we find turnover, that we're always, especially with RNs, we're always looking to hire. We're finding that our wage scale is competitive, especially if you factor in the wonderful benefits program with the pension and the health insurance that the county's able to offer. We always bring that to the attention of our candidates. And secondly, my studies personally have revealed that the number one cause of turnover in an organization is not wages. It's either one, an unachievable or unachievable workload, which is a result of being understaffed, or a negative and toxic work environment. So we try to remedy those two. And we find that people are more content with their wages if they're content with where they're working.
Thank you very much. Just to add, I am a huge fan of your facility, and the fact that we're only one of 17 in this state speaks volumes about the character of our community.
Thank you very much. Yeah, 100% agreed, Member Tompkins. Thank you for that. Any other questions for Director Wiley? All right, considering item 4C and all of its associated subtext, let's take a vote. Those in favor?
Aye.
Those opposed? Motion passes. Thank you very much. Mr. Wiley, anything else that you'd like to share?
just for my report, in August, we had our annual survey, and it actually went very well this year. We were very pleased with the outcomes.
Excellent, excellent. Look forward to reading that. Other business and communication. Our next meeting date will be Tuesday, November 24th at 4 p.m., back to our original time. Members of the committee, anything else to add? All right, thank you very much. We are adjourned.